have another 10-minute presentation coming up from Psyched Wellness. We have joining us Jerry Stevens, the CEO of Psyched Wellness, and Matthew Singh, the Chief Financial Officer. Please give a round of applause for the two gentlemen coming to the stage right now. Thanks, gents.
Hello, thank you everyone for joining us this afternoon. It's a pleasure to introduce you to Psyched Wellness. My name is Jeff Stevens. I'm the CEO, and joining me is Matthew Singh, Chief Commercial Officer. So we'll get right into it. Psyched Wellness is a publicly traded health and wellness company. We're traded on the Canadian Securities Exchange. Our ticker is PSYC, and on the OTCQB in the US, PSYCF. And we are focused on a mushroom called Amanita muscaria, which is a very special mushroom. It's the red and white mushroom cap that you'll recognize from popular culture. And by and large, people are aware of it, but they misunderstand it. They don't understand the qualities that this mushroom has. And that's what we've been doing for the last 2.5 years, working on the R&D side and positioning the company to the point as of 4 to 6 weeks ago where we received approval to start selling this in the United States as a food supplement. So we have a very unique opportunity where we're working with a mushroom that has psychoactive properties, but has never been scheduled as a drug. And as a result of that, we're able to work with it as a food supplement. So we're very excited to sort of move to that next phase of the company's growth. And we'll talk a little further about that strategy as we go forward. The history of the mushroom, if you just take a moment to talk about the mushroom. So it's been used historically by various indigenous groups, Siberian shamans in ceremonial purposes. There's a long history of anecdotal use of the medicinal qualities of this mushroom. And modern day science has supported that. We know that the compound that we work with, which is called muscimol, works on your GABA-A receptors. And those are the receptors that deal with addiction, sleep, insomnia. So we have a very powerful compound, and we're excited to sort of move forward, not just on the R&D phase and the CPG as we take a product to market, but we also have further options with this as well, and we'll talk to that. The regulatory landscape for this mushroom is quite unique. We're probably one of the few that you'll see at this conference that has a compound that is actually able to be sold over the counter. So we don't require a prescription. You don't need a doctor or a therapist. This is a CPG product that we'll have on the shelves, whether it be in higher end grocery, cannabis stores, health and wellness stores. We believe that's because if you were just to pick the mushroom and eat it, you would actually get quite ill. There's one of the compounds that in our extraction process, we convert to muscimol. And without doing that process, if someone were to consume it, they'd get quite ill. So from a recreational standpoint, this was never taken on to any large degree. And as a result, it was never on the radar screen. So again, we get to work with it as a food product. I mentioned that we have a proprietary extract, which we call AME-1. And that is what we've got our provisional patents around, all the processes to get to the point of having this. So we've protected our shareholders and ourselves in the sense that you can't put any patents on a mushroom, but you certainly can on the processes. So we've got 2 years of scientific work that's gone to the point based off of that extraction only, which allows us to have that advantage where anyone coming in trying to piggyback on the work we've done would either have to license our extract or go through the process and do all of the preclinical studies, safety studies, toxicology studies. So we feel very comfortable with where we are in the market share. So I'm going to pass it over to Matthew, who can talk to you about the plan and how we plan to commercialize our products.
Beautiful. Thank you, Jeff. For those of you that don't know me, Matthew, nice to meet you. I've spent the last 20 years working with Coca-Cola, Red Bull, and Vital Pharmaceuticals. So when we talk about our plan here at Psyched Wellness, product development in particular, we took a step back and we said, you know, it's a product. What problem is it going to solve? Effectively, what need is it going to satisfy? When you look at folks in general, globally, but in North America in particular, we're currently subject to a worldwide pandemic, global conflict, economic crisis, the result of which are most people feel overextended, exhausted, anxious, and they struggle to find rest and reprieve. So our team here at Psyched Wellness is very excited to introduce a little calm to the equation, right? Pardon my pun. Calm is the name of our first to market product. So we have a wide assortment in what we want to do with this mushroom and its incredible healing power. But Calm in particular, being the first legal Amanita muscaria mushroom product in North America, will be positioned as a sleep aid. So in the right dosage and amount, when you're taking the certain pre-required droppers, you take it 30 minutes before rest, you experience a deep recovery period while you're asleep, and you rise feeling a better person. It deviates a bit from what you're going to see from the pharmaceutical angle with a lot of psilocybin companies, but it still is in that sphere of total 360 recovery and reprieve. Of course, there's a ton of benefits with launching a product of this nature too. Jeff touched on it in his preamble about the company. Predominantly, we get an uncapped retail universe. What this means is, unlike psilocybin or cannabis, our tincture with AME-1 will be available for sale at traditional retailers. So picture this at your Whole Foods, your CVS, your Walgreens one day, right? It takes time. But essentially, what it means is phase one of our distribution strategy leaves us over 200,000 outlets as relevant, applicable retailer vendors of ours. What does that look like in year-over-year scale? Myself as the commercial officer, it makes me salivate because revenue gains year over year are a lot easier to obtain when you have the ability for horizontal growth, right? You're expanding with new outlets, not just launching new products. If you're asking what kind of segments this product could be available in, picture grocery stores, drugstores, e-commerce, both owned and third-party, health and wellness, specialty shops, and then when we call out the specialty vertical in particular, that could theoretically include cannabis retailers as well. So now that we know we have a product coming to market, the branding done, it's positioned, it's on the cusp of actually hitting shelves soon, so stay tuned for that. We have to answer the question of what's coming next. What is Psyched Wellness going to do to follow up and increase this assortment that I already spoke to? So first, we're going to establish our routes to market and our retailer landscape, and then we work on expanding the actual product applications. So Calm is the first that I mentioned of this diverse portfolio, but we're investing in research and development for areas that include beverage, pain management, anti-inflammation, and the beauty and cosmetics industry. What it'll look like, and you'll just see the generic wraps here because we're not going to release our brandings this far in advance, but we have slow release capsules nearing completion. We have a tea steeping bag that's almost ready, and then we're at the initial stages of our topical creams. So effectively, this then begs the question, how does a startup company manage so many different industries? As we all know, selling and distributing within the cosmetics vertical, vastly different from, say, beverage, from even what we do with the tincture product. And our solution, both in the interim and long term, is Psyched Wellness will have a commercial vertical where we wholesale, white label, and private label the extract AME-1. What this means is we'll look at partnership organizations that align both with our strategy, but also our methodology and where we'd like to see the brand develop. They gain a unique product attribute by bringing a psychedelic mushroom that can still be sold anywhere and adding it to their existing product lineup. Psyched Wellness, of course, gains the additional revenue stream, but also it builds awareness for the Amanita muscaria. Everybody knows what this mushroom is by sight. You've seen Alice in Wonderland, you've seen it on your phone, it's the mushroom emoji, but people still need to learn what Amanita muscaria it is and why North America is lagged so far behind the rest of the world in their use of it. This mushroom is 5,000 years of historical implementation. So needless to say, our commercial team on the sales, marketing, and distribution side is very, very excited for what's to come. And this isn't multiple years out. We're talking 2022. We're talking send us questions soon because this will be here before we all know it. So I'll pass back to Jeff and he'll give us a quick recap of the main points of where we are.
Thanks, Matt. And that's very insightful. Matt doesn't play up his experience, but we're thrilled to have him on the team and leading in that path for us. I guess what I'd like you to leave here with Psyched Wellness and what you think about is a company that bridges sort of the functional and the psychedelic space. We are able to work with our mushroom as a food supplement, which allows us to start generating revenue. So the company this summer will launch its products. and we'll start generating revenue, building a brand. And at the same time, we didn't talk to our team and our board, but we've got some very high-powered muscle on there. It's a psychedelic conference, so we'll mention Professor David Nutt. He's one of our board members. He's leading our sleep study, and he wants to lead the next phase of growth for the company, which looks at drug development potential. So using AME-1 and looking at some of these serious mental and physical health issues, specifically sleep and insomnia, because we know it works there. So the future of the company is to diversify the risk for our shareholders by creating a health and wellness brand, generating revenue, and then also have the opportunity to go into that drug development phase as well, and really create that upside for our shareholders if we're successful in that, like our peers at this conference as well in their various categories. Please reach out to us. We'd love to hear from you. I know we have a shorter time slot and we're at zeros, so we have to stop. But we're not hard to find. We're very newsy. We put out a lot of press releases, a lot of social media impacts. So we'd love to hear from you. And if you see us walking around, please grab us. We'd be happy to have a chat. Thanks for your time.
Thank you very much, Jeff Stevens, Matthew Singh, Psyched Wellness. One question. Anybody have one question for the gents here? Yes, we have one right here.
Consistent composition from one bottle to the next.
That's the beautiful thing about what we're doing. And similar to the cannabis industry as that grew, what we do is provide standardization. So we have protocols in place, batch testing, to ensure that each bottle is going to have a very similar effect and the dosage range is consistent across that. And there's a large community of people who are making their own teas and tinctures and using this for their health and wellness. And a lot of them have reached out to us and are quite keen to see our product, because their concern is each time they make a batch, they don't have consistency. They have to start slow and work their way up to try and understand that. So what we're going to provide to the market is just that, a safe, standardized, consistent product.
Fantastic. Thank you, gentlemen, very much. Psyched Wellness, everybody. Let's give them a round of applause. Thank you very much for being here. Matthew Singh, Jeff Reed Stevens.